older people with multiple long-term health conditions are taking part in a new national research project investigating how yoga can benefit their health.
The study we're doing here is testing the effects and the cost effectiveness of a yoga program for people who are over the age of 65 and have 2 or more long-term health problems. So we're testing the effects of a yoga program called Gentle Years Yoga. It's owned by an organisation called the British Wheel of Yoga, and we're going to assess the effects of the yoga on people's quality of life and other elements of their health, so things like anxiety, depression, how frequently people are falling, and how much healthcare resource they use. The study will last 4 years. It's funded by the National Institute for Health Research, their Health Technology Assessment Programme, and the overall cost of the project is just under £1.5 million. We expect that most people involved will have some form of cardiovascular disease, like high blood pressure or heart disease, and we also expect that many of the participants will have things like depression, respiratory disease or diabetes, but also possible other conditions as well. The main focus of the study is the effects of yoga on people's overall quality of life. We expect many different positive effects though, so there could be physical effects, there could be mental health benefits, and there could be social benefits as well.
We're hoping to include 586 men and women from England, Wales and Scotland. Treatments associated with long-term health conditions accounts for 70% of NHS expenditure. So if the yoga programme can improve and maintain health and maintain self-care, then this represents a significant cost saving for the NHS.
Essentially, the Gentle Years Yoga programme has been specifically tailored for people with a range of health problems and also mobility issues. We take standard asana and other practices, and that we perform them either on the chair or using the chair support as they're standing. We focus on the whole body, and not just a strengthening practice, but we also work on meditation, relaxation techniques, breathing practices, and the big element is social, of course. We interact as a group, and we try to make the classes into a family. Everything that we do is designed to be done at home. However, we do say practice them first with a qualified instructor so that we can work out how to do it safely and then go away and practice it at home.
Well, I'd had a stroke, and rather than sit around and do nothing, I saw an advert for yoga, and I thought it would be silly, people putting their feet behind their ears. I thought I might as well try it, and it's made a hell of a difference. Because when I joined, my right side, I couldn't finger flick, I couldn't balance and what have you. So it's made a big difference to me.
I was a primary head teacher. I took early retirement. I've got multiple sclerosis. It's a very erratic disease. Different people fare in different ways. So I have lots of symptoms, but I'm not disabled. I'm very fortunate, really. I found the yoga enhanced my flexibility, my inner core strength. I found it helped tone my body. It helped my balance. Mentally, it helped me feel that I was coping. And I found that my symptoms improved, my well-being improved, my whole state of mind improved. So it helped socially, emotionally, physically, all round.